Cancer waiting times for people on the suspected cancer pathway have been published today. This new care system replaces the previous one in Wales for measuring waiting times. Well, here to explain more is our health correspondent James Crichton-Smith. James, first explain this system and what it's showing to us.
So this suspected cancer pathway is basically a way of having one queue for cancer treatment as opposed to two. Now, before this, we had two separate queues. One was the urgent suspected cancer pathway. The second was the non-urgent suspected cancer pathway. So this is a way of streamlining it down and basically, they hope, a way of identifying where the long waits occur. When you've got two different streams, it's very tricky to keep track of how patients are progressing through. So that's what they're trying to do, is make it a simpler, cleaner affair. Now, the plan is, under this new pathway, for all patients to start treatment no later than 62 days from when the cancer was suspected. So, how is it doing? Let's take a look at the latest figures that are published today. Now, in December, 1,345 patients started treatment. 882 started within 62 days. Now, that is 65.6%, way off that 100%. Remember, though, most people don't have cancer. 7,999 patients were told they didn't have cancer, so that is good news. Now, the interim target is for 75% of patients to be seen within this time. Clearly, they're not hitting it yet. Ultimately, that number will be 100%.
And what have cancer charities had to say about all this then?
Well, it's broadly been welcomed for the reasons I mentioned, which is it's streamlining the process, making it simpler. I spoke to Cancer Research UK earlier today.
Too many people are having to wait too long for a cancer diagnosis and to start their treatment. And that's really important because we know that the earlier stage that cancer is diagnosed, the more likely that treatment will be successful. And so we've really got to try and deal with the cancer backlog and deal with trying to get these systems working better so that more cancers are diagnosed at an earlier stage. And that's why we're calling for the Welsh Government to urgently publish a new comprehensive cancer strategy that really encapsulates how we can diagnose cancers earlier, how we can recover from COVID-19 and making sure that we've got a sustainable NHS workforce to be able to deliver that.
Now, the Welsh Government no doubt say it's working on a strategy. It would probably even say this single pathway is part of the plan of addressing the challenges around cancer treatment. They do know, though, that it's not going to be easy. Many people during the pandemic haven't sought help when they perhaps should have done. When those people come into the system, that's going to put more strain on as well.